So the eyes are windows to the world. As we age, our eyes, I guess, definitely also age with us. So the recommended screening for adults age 40 is to, once you become age 40, is to have a dilated eye exam. So this is not you go to Costco or to any of the other stores and they do a test. You actually need to go to an ophthalmologist, and your primary care provider could refer you to an ophthalmologist, and they will dilate your eyes. If you're going to have a dilated eye exam, you cannot drive yourself home because your vision will be blurred. So if you're being scheduled for a dilated eye exam, you will be advised to have someone accompany you, and also if you to drive you home or help assist you to go home. Adults aged 40 to 55 years are recommended to have an eye exam, not a dilated, just a regular eye exam every 2 to 4 years. Adults 50 to 64 or older adults are advised to have an exam every 1 to 3 years. Adults age 60 and over are recommended to have a dilated eye exam, again, where to put the drops in your eyes, and you need someone to go home with you every 2 years. Adults every 1 to 2 years, depending on your underlying issue or no issue. If you're just doing for prevention, it may be 1 year, but if you already have been diagnosed with an eye illness or a diagnosis, then you may, depending on your provider's discretion, you may be recommended to come in earlier than every 1 to 2 years. Most health insurance companies will pay for a new set of glasses every 2 years. So you have an eye exam and you're recommended your prescription on your glasses change. You may require something that helps you to see better. Most insurance companies will pay for a new spectacles, eyeglasses every 2 years. Risk factors for permanent vision loss, again, having diabetes, high blood pressure, high cholesterol, anything that can affect your heart. So having diabetes, high blood pressure, high cholesterol actually can adversely or cause bad outcomes or another set of illness that can affect your heart. Adults with diabetes are recommended to have a dilated eye exam every year, and again, at your discretion, or also with discussion with your healthcare provider. And adults with high blood pressure are recommended to have a dilated eye exam every 1 to 2 years. And again, that could change depending on your actual specific illness that you're aware of and that your healthcare provider are aware of. I will discuss the blue box on the left after. Your ears, again, very important for hearing, but not only for hearing. As you can see in the box, it also can lead to dementia. And adults are recommended, all adults, male and female, are recommended to have a hearing test with an audiologist starting at age 20 to 49 is every 3 to 5 years if you don't have any prior diagnosis or you don't have any issues that you're noticing. Adults age 40 to 64 years are recommended to have an eye exam every 2 to 4 years, and adults age 65 and over are recommended to have an eye exam hearing test every 1 to 2 years, in addition to your eye exam. If you have any other issues outside of that time, so you went to see your healthcare provider, and after that you start hearing a sound in your ear that's like a high-pitched sound. It's not from nobody else is hearing it but you. It's only you that's hearing this like continuous whining sound in your ear. It's called tinnitus. That's the reason to go back to your healthcare provider and not wait for the scheduled follow-up exam in 1 to 2 years. That's a beginning symptom of hearing loss. Also, if you notice any changes from the time that you have your exam, going forward, say a week later, a month later, definitely follow up and don't wait for that yearly exam or every 2-year exam. Follow it up as soon as possible because, again, prevention is better than cure. It's always easier, less expensive, and has better outcomes. Prevention when you catch whatever is happening earlier. Having hearing loss or hearing difficulty or hearing deficits, you're not hearing as well as before. Having visual difficulty, vision loss, both or in combination actually could lead to development of dementia and memory deficits. So that's another reason to definitely follow up with your healthcare providers as soon as you notice or if you notice anything. About 20% of adults 75 and over have vision and hearing loss, and research indicate that dual sensory impairment, so loss of vision, loss of hearing, again, typically increases your risk of developing dementia. Symptoms of hearing loss may include, again, not everybody is the same, but these are the common ones that are reported by most persons, is so sounds that seem overly loud or in one ear or the other, or sounds are decreased in one ear or the other. Difficulty following conversations. So if you're in a crowded room or you're in a mall or you're in somewhere that's noisy, you're having more difficulty hearing when someone is speaking to you. Not just the person standing in front of you, but you have difficulty hearing overall. Trouble telling high-pitched sounds such as S or T, so somebody is saying so or the, and you're having difficulty differentiating between an S and a TH sound. Less trouble hearing men's voices than women's voices because men's voices are lower. Hearing voices as mumbled or slurred, or having to ask someone to repeat what they're saying over and over. So this is something, again, that is may indicate, not definitely, but may indicate that you're having hearing difficulty, and the only way to confirm or to rule that out or deny that is to follow up with your healthcare provider as soon as possible. You could also feel off when you're walking. Your balance may be off because your hearing is at your ears. Your balance is actually regulated in your ears. So if you're you're fine before, and then now you're having difficulty walking, you're feeling off balance, you're drifting to one side, dizziness, presence a pressure in your ear, along with the buzzing sound that I spoke about before, tinnitus, then that's definitely something to follow up as soon as possible. Mouth and dental exams. So the American Dental Association recommends dental exams every 6 months for everyone, not just older adults. So everyone should have a dental exam every 6 months, and most insurance companies will pay for that because it's a recommendation from a certifying organization. Dental X-rays can also be included in that, depending on your health insurance, and cavities, gum disease, bone loss, and other problems that can. So that's what they're looking for. Why we are having these exams every 6 months. Your dentist will evaluate if you need for additional tests, depending on what they find at these regular. So these are regular screening exams or preventive health exams. So if they find an issue, then they will change your plan or recommend some other follow-up that may be needed for whatever may be found. But most persons have a regular dental exam, including x-rays, every 6 months. And again, cavities, having cavities, the infection that may develop in the cavities could actually end up affecting your heart. Other things that may be found in the mouth, bad breath is not something that you should live with. Depending on what it is and what the source is, it can actually be resolved. Having loose or missing teeth affects your ability to eat, affects your weight, affects your overall health, well-being, and getting the nutrients that you need to survive. So it's a lot of persons do not take care of their teeth. It's the lowest priority on their list, but it's very, 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 very important. You may actually develop cancers of the mouth, so you could actually have cancers of the tongue. You could develop cancers in your mouth. So if you have any new sores or any breakdown in the skin in your mouth, that's something that you should definitely follow up on as soon as possible. Our lungs, we're required for breathing. There are a few illnesses that are specific to the lung. Asthma, if you have asthma, you know you have asthma. It can change as you get older, depending on the environment where you live. If you're exposed to any infections in your home, like mold or dust or mildew, that could actually make your asthma worse. The medication that you're taking may not be as effective as they were before. These are reasons to follow up with your healthcare provider. Tuberculosis, not as common in the United States anymore, but if you're traveling to another country or coming back from a trip to another country, then you may actually have been exposed to tuberculosis. Again, coughing. So many of these lung illnesses start with coughing. So if you're having a cough for a prolonged period, over a week, that's not getting any better or maybe getting worse, then definitely follow up with your healthcare provider. Acute bronchitis, COPD, persons that have smoked, or for other if they're for other reasons may develop a chronic pulmonary obstruction, so they have difficulty breathing most of the time. Emphysema, another illness that develops from exposure to a noxious substance. Pneumonia, so again, one of the vaccines prevents pneumonia. As we get older, persons do the risk for getting pneumonia does get worse, and pneumonia is a very serious illness that can lead to death. ARDS, respiratory distress syndrome, RSV, as I said before, cancers of the lung. If you're a smoker, actually, some persons do get cancer of the lung that have never smoked, but if they live with somebody that smoked, that increases their risk of also getting lung cancer. COVID-19, and just trauma. You were in a car accident, broke your ribs, punctured your lungs, anything that happens. So there's different illnesses that can happen with the lungs. I said anything that changes from your normal that you're concerned about, that's going on for a long time, that's something to check out with your healthcare provider. Smoking at each visit, wellness visit, annual visit, we healthcare providers do ask you about smoking, and please tell us the truth. We're not judgmental, we're actually trying to help you. So smoking tobacco or illicit substances actually contributes to developing lung problems. Tobacco smoking, we do try to advise you and assist you to stop smoking. So the sooner you stop, I know persons that's been smoking like 20 years and they said, I'm fine, so I'm not interested in stopping. But the longer you go, as I said, as you get older, your body systems do not recover as well. They don't protect you as well. So as you get older, you maybe have been smoking for a while. As you may actually now, your risk is now increased that you may actually develop lung cancer or any other of the illnesses on the prior slide. So smoking cessation, stopping smoking, we're always going to ask you about that. There's assistance for you to stop smoking. There are patches, there's gum, there's medication to help you to stop smoking. And the longer you smoke the more your risk of having any of the other illnesses that I had on the other slide may develop. So whenever you come to see us, we ask at every visit about your tobacco use. We also ask about your alcohol use. And we recommend and advise you to stop. We assess how willing you are to stop and how willing you are to accept assistance to stop. And then we could actually refer you to other healthcare providers that could assist you in your attempt to stop smoking. So smoking, tobacco, chewing tobacco is actually not as well, not good either, because then you're increasing your risk of actually developing throat and oral or cancers of the mouth. Now that marijuana is some amounts of marijuana is increased, I know a lot of persons are smoking marijuana. Just to smoke it, that's not the only way that you can use marijuana, the medical marijuana. Smoking is actually not recommended for marijuana. You could have tea. You could, a lot of persons put it in baked goods. Anything you could do with your legal medical marijuana is fine except smoking. So smoking marijuana, even though that is now legal, still increases your risk of getting lung cancer or any other cancers of the mouth. So healthcare workers and other persons now in the community can develop tuberculosis, as I said before. Tuberculosis testing is not as prevalent in the United States as we used to have where you stick your skin. We're not doing that anymore. There are other more specific, so the results are more accurate. There are more specific testing that you can be recommended for. So we still ask about tuberculosis, but we're not doing it's called a time test anymore. And we want to decrease the incidences of lung cancer. Asymptomatic adults, that means so you don't have any symptoms, you're not coughing, you haven't noticed any changes. The governing body that makes these recommendations recommend that you get a low dose scan, a low dose scan every for persons 55 at age 50 to 80 years. So everyone between age 50 and 80 years should get their first low dose scan of their lungs, just to see if there's anything happening. It's in its early stages that could be stopped as soon as possible. And as I said before, current smokers with a smoking history, it says here 15 years, but any smoking history at all is also recommended to have this low dose scan as soon as possible. Or definitely by age 55 or between 55 and 80 years. Another governing body that makes recommendations, healthcare recommendations, the American Heart Association recommends checking blood pressure every visit. So every healthcare visit, that's why we check your blood pressure. And we're checking to determine if you have high blood pressure or not. And if you have high blood pressure, you may follow up at shorter intervals with your healthcare provider to make sure that the levels are not are in control or within the normal ranges. Because having high blood pressure not only is not just like having high blood pressure or having hypertension. Having the blood at that pressure, so your blood is actually pumping from your heart at a very higher pressure than normal, can affect your brain, can affect your heart, affect every system of your body in a bad way. So that's why we check and we try to get you on medication and follow up with you about how are you taking your medications properly. And the number one, I think most people know that it actually can cause you to have a stroke. So adults with elevated blood pressure should have their blood pressure checked every 6 to 12 months. And again, it may be different depending on what your healthcare provider knows about you and what they recommend. Adults with normal blood pressure, so within the range, can have their blood pressure checked at least every 1 to 2 years. An EKG, so that's a check of your heart where they put the pasties on your chest. If you're diagnosed with hypertension, you should have your first EKG once you're diagnosed with hypertension. As I said, it can adversely cause problems in your heart. And then follow up EKGs every 1 to 2 years to make sure that there's no, it's not worsening if there's something was found or if it was normal, if something is happening now after the first time you had an EKG.